So let's talk matters innovation. And today we are focusing on healthcare. On this week's episode of The Innovator, we showcase a pair of students who are revolutionizing infant care by creating portable care kits for mothers to monitor babies' health. Take a look. Maternity health care has been an area of concern in Kenya, with organizations, both government and non-governmental, joining hands in addressing the child mortality rate in the country. Kenya's child mortality rate fell gradually from 151 deaths per 1,000 live births in 1970 to 43 deaths per 1,000 live births in 2019. The phenomenon has been attributed to poor healthcare and because of the frequency in sparsely populated areas, as well as arid and semi-arid lands. Students from the United States International University, USIU, Africa, saw the need to address the issue by creating more user-friendly solutions.
My name is Hamid Ali. I'm a current alumni of United States International University, Africa. So I'm the co-founder of Reweba, which is a remote infant monitoring system, which does postnatal and care, and it's an early intervention system. Me and my friends were doing a community service in a hospital, and we actually saw mothers. We were working there. We interacted with the mothers and saw their suffering, whereby most of their babies were actually passing away. And upon doing some research into it, we found that this problem was actually huge, and decided to take on the responsibility to help mothers and save more babies and save more babies.
Together, they developed the device known as Reweba, an infant care kit that can be used at home by mothers to monitor their children's health condition. With combinations of machine learning and artificial intelligence, the mechanics within Reweba can make quick assessments, knowing what disease ails the child for early diagnosis, and remits the results in real time to the doctor for further action. The baby is placed on top of the table-like surface. Then through biometrics, the device is able to run a diagnosis that informs the next point of action.
For the ideation process, it took us about 2 years to where we are at now. However, this is just not an actual prototype. We actually have another prototype which is almost ready, but it's just the first version, proof of concept.
Abdi attributes the challenges in child mortality to a weak diagnostic medical system in the country. He asserts there's urgent need for change.
In our use case, especially our device, we find that if it's placed let's say in a hospital, we will have less use. So even for the product's shelf life, it's better for it to be taken to the mothers who are actually in the remote areas. We also find that the biggest problem is also the education. Like even the mothers being told about there's a need for them to check on their babies every time. So we also plan to roll out later on a program whereby we teach mothers on the importance of screening their babies till 5 years, so that if there's a case or a problem, they can be able to detect easy. And prevention is better than cure. So with that, I feel like more hospitals or more nimble solutions should be taken to people in need, especially in rural areas, people where it is marginalized. As you have said right now, the main construction is happening in urban areas. If you go to an urban area, the count of hospitals and pharmacies is a lot more compared to remote areas. So as a Reweba, our main focus is reaching these people who have been ignored for a while, and also the device is also very important in terms of being able to detect for the government and other stakeholders if there's an outbreak, because from the data we get from the device, you can be able to know if a specific place, let's say Kitui, Machakos, even Garissa, in a place of that sort, has a specific outbreak. And I mean by village, we can be able to detect early of any outbreak and we're unable to counter it and before it goes.
Just at launch stage, their business model has traits of social enterprise-like.
Our business model is not about selling units. Okay. We prefer to give because if we sell a unit, we don't get a good out of use for our product. Maybe to hospitals, yeah, but for now, our target market is giving the device to a specialist, many community health workers who go from place to place measuring the babies. Thus, we can be able to help mothers who cannot even afford the product. They will just pay around 300 to 500 shillings for the community service health worker to come, and also get feedback from the doctor and also get automatically feedback from the device via an SMS, and later on get, if it's really critical, later get a call from a doctor on what to do next.
Having taken 2 years working on the prototype, Abdi says they still need more support to maximize on the potential of the device and the business aspect.
So right now we actually partner with an Gearbox, and we actually in talks with the Kenya Pediatric Association, so that they give us a direction on what to do and what not to do. But in terms of active partnership, we don't have any, apart from those I've mentioned right now.